hospitalists are internal medicine trained doctors. We go to medical school, we specialize in internal medicine in our residency program, but instead of going out into a private practice and specializing in an office-based practice, we get a job in the hospital and only take care of hospitalized patients. We're not taking the place of primary care physicians, but we're allowing them to focus on their primary care practice while we focus on hospital practice. I was a primary care physician for most of my career up until this point, and I always used hospitalist service in my practice because it allows you to focus more on your patients that come to see you on a daily basis in your practice. We try to emphasize that we're not trying to take the place of their primary doctor, but that we're working with their primary doctor and taking care of them while they're in the hospital. So it's like you have a hospital doctor and you have a primary care doctor. I can spend as much time with patients as I need to spend based on what their medical conditions are and what the situation needs. Also, you get to interact with the specialists quite a bit. At Chestatee Regional, we have the cardiology group that comes there, so we get to interact with the cardiologists. This is the same group of physicians that are at Northeast Georgia that we know from down there, and so we get to see them up here and also meet a new group of physicians and the surgeons that are here and the orthopedists that are here and the anesthesiologists that are here. I always felt like growing up that I wanted to be a doctor. And I always was good at science, always enjoyed those kind of things, and so that's where my interest started. I got interested in exercise physiology. So I went to graduate school at Temple in Philadelphia and got a master's and a PhD in exercise physiology, and then decided I wanted to go to medical school. So I went from there to back home to Atlanta and went to medical school at Emory. This area has some of the best health care that you could get anywhere in the state of Georgia. I just think it's wonderful to be able to live in a small town like Gainesville or Dahlonega, but be able to receive the same quality of care that you would get in Atlanta.